assembled equipment, wash hands, assess for fluid or electrolyte imbalances that may be affected by IV infusion, lab work, blood pressure changes, decreased urine output, and behavioral changes. Explain procedure to patient and assist patient to a sitting or supine position.
Want the patient comfortable.
Open sterile packages using sterile aseptic technique.
There's usually a IV start kit.
Check IV solution using six rites of drug administration. Check solution for color, clarity, and expiration date. Open infusion set, maintaining sterility of both ends of tubing. Place roller clamp about 2 to 5 centimeters below drip chamber and move roller clamp to off position.
It's strange that this is on this side of this thing. Usually it's the other way around. But anyways, in order to get up there, you have to move this thing. But most of the time, this is on the other side of the roller. Okay?
Remove protective sheath over IV tubing port on plastic IV solution bag.
This. And if it's a new one, it's usually kind of hard
Oh
to
no.
pull off. This is very easy to pull off. So you want to be careful about that. Make sure this is upright for demonstration purposes.
Insert infusion set into fluid bag by removing protective cap from tubing insertion spike. Keep spike sterile. And inserting spike into opening of IV bag.
And then doing a little twist helps it to go in real time.
Compress drip chamber and release, allowing it to fill 1/3 to 1/2.
Okay, so then I'm not going to do this on this one right now, but the clamp should be on. Make sure the clamp is clamped.
Open clamp and prime infusion tubing by filling with IV solution.
So I pass full this, and then I partially open this, let the fluid come all the way down to the end.
Prime tubing, making sure the tubing is clear of air bubbles. Clear any bubbles by tapping the tubing where the air bubbles are located.
And once you get air bubbles in here, it's a pain in the neck to get them out. So make sure that you have this half full and that you're running this fluid through slow enough that it's not getting a lot of turmoil in there. And that's where all those bubbles come from.
Apply disposable gloves. Identify. Identify accessible vein for IV placement. Cleanse site with an antiseptic solution according to the agency's policy. Apply a tourniquet 4 to 6 inches above proposed site.
Okay, so this set has Tegaderm in it. And it has gloves in it. And it has a little tourniquet and tape. And it has floor prep information, so it has your floor prep. In this case, this is what they're using. So when something looks like that, have you used this before?
Yeah, so
You-
break the inside.
You press, yeah. And for the fluid to come out at the end.
Could you show me?
Have you used it before?
Yeah, there's like a glass in there, and you break it. That's how
Yeah.
the fluid will go into this gauze, and that's when you use it.
Want to show?
Do you want me to break it?
Sure.
open this?
Oh, go ahead.
So there's like a glass in there. Can you see? And then you squeeze, and it's between the side.
Oh, it's to clean the side.
Mhm.
Is that an older? There's another one where it's like a stick. It's like a glue.
Oh, yeah, every site uses different equipment, but the concept's the same in terms of how they work. Okay, so, all right, so, I have gloves on.
So you apply the tourniquet 4 to 6 inches above the proposed site, and you check for the presence of a radial pulse.
Now, why is that?
So you don't want to block arteries, just the vein.
Correct. So you want to still be able to feel the pulse with the tourniquet on, make sure it's not too tight. Okay.
Perform venipuncture of anchor vein by placing thumb over vein beneath insertion site.
So this is my non-dominant hand, so I was going into this one. So I would find the vein, and you can do that with the lower of your 2 fingers, putting just a little traction pressure going down. Stabilizes it.
Okay. Warn patient of a sharp stick. Puncture skin. Puncture skin and vein, holding catheter at a 10 to 30 degree angle with the bevel pointed upwards.
I was reading that if you like press up against the skin for a little bit before entering, it kind of dulls the nociceptors, so it doesn't hurt as much. Do you do that when you?
I haven't done that, no.
Can
But
you see what it's
maybe
like
it'll
to
work.
the bevel? So the bevel.
See the bevel? It's like on a slant. Can you see
Okay,
how
yeah.
the needle is slanted? So that the hole is facing up. Okay?
What gauge is that?
This is a 22, I think.
And when you
Small.
where's the catheter? Oh, in the
Catheter is in here. See, this is closed off. And so you would.
There you go.
I didn't mean to pull that back.
So it's sucked back in.
Yeah, but well, I didn't quite do it right. So I didn't.
Oh, those are the ones that are like the automatic ones, where it just
Yeah.
as soon as you go in and you just
Huh?
suck the needle.
It's like the needle in.
Yeah, see,
Yeah.
the needle's in there, and
Oh, those are
this
cool.
would have been in the catheter, when you pull that back.
So once you're in, all you have to do is push that button.
And then it just takes the needle.
Yeah.
That's cool.
Just the needle sucks back.
That way you don't have to pull the needle back out. Oh no. And get the duck.
That's weird. Okay. So, it's gonna be hard to show. This is a big needle. So you put tension. You go in at an angle till you get flashback. And then you want to, release your tourniquet if it's not off already. And advance the needle just a little bit more. What's it say?
Look for blood return through tubing of flashback chamber of ONC, and then advance ONC catheter into vein, and then loosen stylet. Advance catheter off stylet into vein until hub rests at venipuncture site.
Right. So that's when you'd release this. So the needle comes out. And then you have your IV set up right here ready to go. So then all you have to do is put pressure above the end of the catheter on the vessel and pop the end off of that and plug it in from your IV. Okay? You don't want to ever let go of this because it could pop back out again. So keep it stabilized, and then you can open up your clamp and Make sure that the fluid flows well, there's no infiltration, no pain, no swelling.
Stabilize catheter and quickly connect adapter of primed fluid administration set. Release roller clamp slowly to begin infusion at a rate to maintain patency of IV line. Tape and secure catheter.
And then you tape it. So like if you had this, you would put your Tegaderm right over the end. So you wouldn't have to worry about using tape or whatever. And use a grate because, you know, it keeps it nice and clean and not contaminated. Now, even though that's what that says, what you typically would want to do is have, like they showed in the video, you'd have your little short tubing and saline solution on the end of it. And so you, instead of opening up the IV, you would, because when you want to end up, you want to have that little loop of tubing. So in case you have to change the tubing, you don't have to change it right at the site. And then you can flush with the saline as opposed to opening up the IV. All right. And then you get everything all set up here, and then you can hook your IV up to it once you get this all taped down. Okay. And that, I think you'll find, is what's done most frequently in the clinical area.
If there's a lot of blood coming out, are you still allowed to hook up the IV and stuff, or do you need to stop?
Coming out of the catheter?
Yeah, if there's a lot of blood, because I just saw a video of that and I was like, I didn't know what the guy was supposed to do because I stopped watching it. But
Well, you want to have that right here ready to go to hook up, right? So the idea isn't to have a lot of bleeding. So one suggestion in the video was to actually put like a 4x4 or something under here
Okay.
in case there is some dribbling of blood, that would catch it. And remember, your second finger is up here on the vessel. So by putting pressure on that, you should be able to stop that bleeding.
okay.
So, so when you pop that out, advance this, then you put the pressure there before you pull this out and hook up the IV tubing to it.
Okay.
And then it's not going to, once the IV tubing's connected to it, it's not going to be coming out anymore, right? Because then you'll be flushing it with the saline.
Okay.
But if someone just put this in a vessel and took the thing out and that's all we did, yeah, the blood's going to pour out of there because you now have an open line right into the vessel. So those are the two ways, putting pressure here and then getting your IV hooked up right away. That tubing hooked up right away.
Professor McKissick, I was observing a nurse, like, he was gonna start one, but he put the tourniquet on, and he was just like slapping.
Oh, slapping the thing?
Yeah, what was that all about?
Well, if someone has a real difficult stick, sometimes that can make your vessel pop up a little bit. But you just have to be careful that you don't bruise the vessel by doing that, because then it may have the opposite effect from what you want. Sometimes people will put, for a real difficult stick and they can't really feel a vessel, they may put a little warm compress on it and then wait a little bit, wait 10, 15 minutes and then come back before they try and start the IV. It's usually for a difficult stick that you do something like that. Sometimes people will have shy vessels so that when you go under the skin, the vessel contracts on you. And I've found that if I just wait a little bit, like Stephen, 10 or 15 seconds, the vessel might, relax back down again so I can feel it. Good. Because if it totally disappears on you, you can have trouble finding it. So, not everybody's vessels will do that, but sometimes they do. They'll tighten up a little bit for, it's kind of like if somebody pricked you, you kind of go the same way. So the vessel might do that on you. If it's a tiny one, it might make a difference. That's about all there. When you take an IV out, or same way, let's say you try this and you don't get in. Before you take this out, have your gauze ready to put pressure. And don't wait, because if you take it out and then put pressure on it, that whole time in between, they are bleeding into their tissues, and they'll end up with a huge bruise, and it's painful. So once you take it out, you immediately, when it's out, you want to put that pressure there and hold it, and then you can kind of check, ease up and see if it looks like it's going to be controlled. You may want to hold it for a little bit, or you can put a pressure dressing on it, fold the gauze over and then kind of a tight, not all the way around, but kind of a tight tape for a little pressure on it if they ooze a little bit. But there was a time when I used to let people start IVs in me, and it was just too painful when they didn't do that. And you bruise and you get this huge hematoma under your skin. So, okay.